Okay, let's talk about thyroid, which is the master of your metabolism. It is constantly trying to figure out how to respond to whatever you've gotten yourself into. So if you're in a stressed state or a relaxed state, your thyroid's going to, keep up with you. It's going to fine tune your metabolism. It's super important for growth, especially in children, for energy and mood. And if any of you are hypothyroid, so you have an underfunctioning thyroid, you know that when your thyroid's off, you don't feel good. And I have had patients who were, they've had a total thyroidectomy, and it's been really hard getting the thyroid replacement right so that they can feel like they can function. So it's actually really awful when people, don't have their thyroid meds quite, dialed in right. There's also data that thyroid plays a role in remyelination, and it can actually protect the central nervous system. So it's really important to get thyroid right in MS. This is a gland that's really sensitive to the environment because it's constantly trying to figure out what's going on and how to respond. But that also means that it can easily get damaged. And so, it's susceptible to autoimmunity. It's susceptible to damage from toxins in the environment. So one of the things we're going to kind of wrap up with today is how do we minimize damage to the thyroid gland? Okay, and of course, as far as autoimmune conditions, Hashimoto's is one of the most common autoimmune conditions worldwide. Antibodies can develop against the thyroid gland, and over time, thyroid function can decline. We don't generally check these thyroids in patients in conventional medicine. However, I do check them in my autoimmune patients, because if you've got one autoimmune disease, that means you're good at getting other autoimmune diseases. And in Western medicine, we don't pay too much attention to this because, well, if somebody has antibodies floating around, but their thyroid function looks normal, what do we tell that person? Come back and we'll talk about it when your TSH has gone up and you feel bad, right? But in integrative and functional medicine, we go, oh, okay, maybe this is a clue that your thyroid's going to decline, in the next 5 to 10 years. So let's work on supporting the thyroid. Also, Graves' disease is another autoimmune condition. It's a hyperthyroid condition. By the way, if anyone here has Graves' disease, please don't take ashwagandha because it can actually raise your thyroid levels some more. So just want to make sure everybody's being safe. Okay, so let's talk about what suppresses the thyroid. Trauma could be emotional or physical trauma, like a car accident. Infections. People oftentimes will have a viral infection and then they can come up with a thyroiditis afterwards. Radiation, medications. This is why we used to shield everybody when we would do x-rays, because we didn't want to give extra radiation to the thyroid. We don't follow that practice anymore. But there are medications that can damage the thyroid, toxins in the environment, as I mentioned, lots of stuff floating around in the environment that are man-made compounds can get in and damage the thyroid. And then autoimmune diseases. If you have a propensity towards building antibodies towards your own tissues, it's possible that you have a higher risk. That study I showed you showed that people with MS have a higher risk of autoimmune thyroid diseases. Okay. All right. And what do we do to support the thyroid? I always like talking about the things we can do because sometimes it feels like doom and gloom, but there are real strategies that actually work. I have had patients who are dead set on protecting their thyroid. We know they have antibodies. We've measured them. And then they go, what do I need to do? And then we do it. And then I see their antibody levels fall. So it's really wonderful to see that shift, because I think it shows us that our bodies are dynamic. And if we create the right conditions, we can move things in the right direction. So as we talked about with cortisol, stress is bad for the thyroid. So managing stress is important. Good sleep is really important. Non-intense exercise, like I said, like this list isn't that different from what I said for cortisol, right? So see, it's like a 2-for-1, right? You do these things and you'll get both hormones to go back into balance. Minimizing toxic exposures. If we can just offload the thyroid and have it see less toxins, that it's going to be damaged to a lesser degree. And then food sensitivities. There's still this uncertainty around what we should be telling patients about gluten and dairy. And I'm never certain either, but what I am certain about is cut out at least gluten and dairy for 6 weeks, maybe even longer, 6 months. See how you feel. See if your thyroid numbers rebound. Did the antibody levels go down? Do you feel better? And then if you've missed those foods and want to reintroduce them, go ahead and reintroduce them. But I don't have a way of looking at somebody and going, you are sensitive to gluten and you need to cut it out. It's actually really hard. And even our lab tests aren't great at picking it up. So we're now doing a 6-week gut restoration protocol in the Truemedicine program. And we have cut out, we're in week 3, I think, of cutting out a bunch of these foods that can contribute to lots and lots of dysfunction, from thyroid to cortisol, to the immune system, to skin, to the gut. So it's an experiment worth doing, these elimination diets. And then eating lots of plant-based foods. And what you need to know about plant-based foods is that it's a very efficient way of delivering vitamins and minerals and phytonutrients to your body. And then, of course, minimizing sugar. So look at this list. Where is your greatest area of opportunity? What are you doing really well? Keep that up. What can you improve upon, right? And, managing stress. Well, that's not something you can do in a day, but it's something you can plan for. And over the course of many weeks to months to a year, you can actually make tremendous progress. Okay, and then as far as supporting thyroid, there are nutrients that the thyroid needs. So like vitamins A, the B vitamins, and then vitamin D. And there's a study that I pulled here that showed that people with low B12 and low vitamin D levels correlate with having higher rates of thyroid antibodies. Now, that doesn't mean that the low B12 and low vitamin D cause the thyroid antibodies, but these things tend to occur together. So my approach as an integrative functional medicine doctor is that if you come in and I know you have an autoimmune disease, I will check your thyroid antibodies, and let's say yours are positive. I don't tell you to go and come back, in 2 years or 5 years. So let's check your thyroid. I go, okay, let's make sure you have enough B12. What's your vitamin D level? How's your zinc, iodine, and selenium? Right? So iodine is actually a really important nutrient that is low in people who are vegan, for example, right? Because, if you're not eating fish, the other sources are, seaweed, iodized salt, thyroid needs iodine, and you don't want to give it too much iodine or too little iodine. You got to kind of just, eat it, get it throughout your diet. So you might need to supplement if you're a vegan. And then selenium is also important. And by the way, selenium is found freely in Brazil nuts. 2 to 3 Brazil nuts get you your day's worth of selenium. So I always make sure that these nutrients are coming in. And then I always check people's iron levels just to make sure that they're not low, because I find a lot of my patients with fatigue may have normal thyroid levels. They're not anemic, but their iron levels are low. So I have them get a transferrin saturation checked and a ferritin. These are called iron studies. So, if you have thyroid issues, you can ask your doctor if they'll check your iron studies. And I like both of these numbers over 30. People feel kind of crummy when their levels are lower than 30. But, the thyroid, in order for it to tick away, it needs these nutrients. Now, I'd love for you to get them through food, right? Getting a broad diet. So all of these things are coming in through natural, unprocessed foods. But there are also combination supplements that you can get where it's for thyroid support, and it's got a little bit of all of these nutrients. And that, I think, can also help to make sure you're getting what you need. I wouldn't start taking iron unless you have a deficiency, unless these numbers are low. Okay. Iron is not fun to take. I always feel like it's like licking a pole or something. It just tastes terrible. And then remember, we talked about adaptogenic herbs like ashwagandha. But, again, these adaptogenic herbs can be really helpful to sort of harmonize your hormones and your thyroid gland. So this study showed that 8 weeks of ashwagandha at 300 milligrams twice a day, this is a low dose, was able to lower the TSH level. Now, remember, when your thyroid is under functioning, TSH goes higher. So a high TSH means you have an underactive thyroid. So what ashwagandha did is it lowered the TSH and it raised the downstream thyroid hormones, T3 and T4, compared to controls. Okay, so this is a reasonable herb to use. What I like about ashwagandha in comparison to the other adaptogens in the family, like rhodiola, holy basil, licorice, is that ashwagandha kind of helps with all levels of cortisol problems. And again, don't use it if you're hyperthyroid.